you can see it now.
Yes.
And that you can also hear me.
Wonderful. Yes, we can hear
Very
you.
good. Okay, thank you so much for the introduction. So in that case, I don't need to introduce myself. And I, of course, wanted to thank the Swiss Learning Health System in the first instance for the invitation to be here today. I'll be talking a little bit about our links as well, the observatory and this platform, this system. And yeah, you've given an overview of what I do for the observatory, but I thought that in order to first of all to talk about tailoring knowledge, to emphasize that Natalie kindly gave me an overview of the audience that we have with us today. So I'm trying to keep in mind that we have a diverse range of backgrounds and institutions. So it's good to have that diversity. And yes, we can dive into it. And before I talk about the observatory, I thought I would give you a little bit of a flavor into my own journey into health and science communication, because I keep hearing the question, what do you do? And I feel that every year or every couple of years, my answer changes slightly depending on how people perceive science communication. And that's been an interesting experience. So I would see science communication as something that encompasses various groups of stakeholders or actors or people, if you like. And I would say I started on the right-hand side of the screen as the general public. So the slightly bigger than usual baby you see here was me when I was born, next to my mother. And my mother is actually a medical doctor. She's a GP. And I would say she's 90% the reason why I ended up doing what I do today as a job, because not only I was fortunate to have my doctor at home throughout my life, I also was able to ask her many, many, many questions. And I would always like to go to school and tell my friends that they were not doing the right thing, or they were doing the right thing when they had some sort of injury. So I've always had this fascination for how we should communicate things that sometimes are quite complex about our bodies and medicine in general. But I never really thought about becoming a doctor because I really wanted to become a journalist. I've always been interested in writing and telling stories. So I ended up following that path. I studied communication sciences in Portugal, where I'm from, and I finished the studies in Germany. And that's how I started working as a journalist at Deutsche Welle Radio. And I remember then I was there for a few years, and I remember always being extremely excited about all the health-related topics. So if there was a new report on a certain disease or World Tuberculosis Day, I would always put my hand up because those were the topics that I wanted to cover. And so my frustration at the time, and this was about, I don't even know, 15 years ago maybe, I was frustrated because I couldn't really find a university that would let me in to specialize in this field without having a prior scientific background. Eventually, I did find one. I mean, there are more, of course, and especially in the US, there were quite a few options at the time when I wanted to stay in Europe. So I went to London and I did a master's in science journalism at City University. And that was a very eye-opening experience for me. I was there for 1 year studying, and it was eye-opening because we were quite a small group, but we were very diverse, maybe like the group that we have here today. And even though I was not a native speaker, and I still am not a native speaker, I was able to help my native speaker colleagues to write headlines because they came mostly from a scientific background, and they would write these news stories with 3 lines of a headline. And so we all learned from each other things that were very obvious to them, like peer review, were not obvious to me at the time, because that's now, I had not gone that far into my scientific studies back in school to understand how it all worked. And I think that's really the basis for good science communication, is that you're able to communicate with people from different backgrounds, to ask the right questions and to learn from each other in that process. When I finished the studies, I thought I would remain a journalist and I could call myself a science journalist. And I did that for a while. I also had a nice experience with The Guardian reporting on cervical cancer for a series of articles. And then also I was in Switzerland, in Geneva, working with the WHO Bulletin for a short internship. And at that point, I also realized, or I was becoming closer to the research environment and the scientific environment. And realizing that there was this huge gap between what journalists do and what the scientists as a whole do. And so I became more and more interested in the world of communications officers in research institutions. And so I went back to the UK and I worked there for a few years. I worked in the areas of dementia and malaria. Malaria was at the London School of Hygiene and Tropical Medicine. And again, this was really, really a nice experience because I was embedded in a research environment with my communication skills. And again, we helped each other in that process. And until today, I talk to colleagues in these offices who tell me about the exchanges we had at the time to try and understand each other's worlds. And I think it's in this dialogue that we learn a lot. So after that experience, I moved back to Portugal and I worked for the National School of Public Health. And this was my first contact or very direct contact with policymakers, with the Ministry of Health in Portugal as well. It wasn't as straightforward as it was to communicate with scientists, and that's an interesting experience, but it also has to do with a particular context in Portugal. But still, it taught me again that you always have to think of the audience that you're communicating with and to tailor your message to that audience. After that, I became an independent science or health communications consultant, and I worked with the European Public Health Association, which again was very interesting, especially because that's when our beloved COVID-19 pandemic hit us. So actually, it was the best and the worst place to be because there was a lot of work. But at least for once, or for the first time in my life, when people asked me, what do you do? And I said science communication, people finally understood what that meant. And I think if there is a silver lining around the pandemic was that people started appreciating and valuing the importance of science communication and the importance of putting the two worlds in dialogue. And then I also worked as a consultant briefly with the WHO Regional Office for Europe before joining just over 2 years ago the European Observatory on Health Systems and Policy. Throughout this process, there was always a lot of talk around disseminating research or disseminating whatever work my colleagues were doing in their research environments. And I always kept these three reasons in my mind that mostly people agree with, is that the reasons why we need to disseminate research are first to transfer knowledge to society, which is obviously the main reason why we're here today. And here I always like to remind myself that the gap between the health we have and the health we could have is not primarily a failure of knowledge, but it is a failure to share that knowledge effectively and to translate it into action. So there is no point in having that knowledge sitting on shelves or in only the scientific communities if you're not able to put it out there, especially to policymakers. But there's also other reasons that also helped me to persuade scientific colleagues to communicate more in my journey. And one of them is definitely that it helps to raise the visibility and the academic profile of not only individual academics, but also research institutions. And you can see the impact that it has over time. And then there's also the ethical reason, which is whoever gives you money. And when I say you, of course, I'm not finger pointing at all. It's just that for the research community who receives funding for different projects, it's always an ethical commitment to give back or at least to report on what has been done. And that's part of my role as well, of course. So that was a little bit about my background, and I think that explains why and how I do the work that I do right now within the observatory. But first, I wanted to get a sense of who is familiar with the work of the observatory, and it's totally okay if you're not super familiar because it is a complex structure. But again, I'd like to understand who I'm talking to adapt that. Now, the problem is I don't see faces, but I do see Kangilom, and maybe I can ask him to tell me how many hands up we have for people who are familiar with the observatory, if you're able to.
So I am checking the. Okay, so we have one hand up, second hand up.
Okay.
5 hands so far.
Okay.
Okay, from about
Excellent.
21 attendees. Okay.
Okay, that is not, if that's any consolation, that is not uncommon. And it's actually more interesting to me because then I get to tell you something new. And even for those who are familiar, you may know things that are not, that you didn't know before. So first, I should just highlight that the mission of the observatory is to bridge the evidence and health policy. And I guess here, I really like that because I also like to consider myself a bridge between the two worlds. So in that sense, we are aligned. And so the European Observatory on Health Systems and Policies is a partnership. It's hosted by WHO, and that's why a lot of people sometimes think that we are WHO. And actually, I am WHO staff, as are many of my colleagues, but we are just hosted by them. We also have many other partners involved, in particularly the European Commission. And you can see here on the slides the countries that are represented, including Switzerland, in our partnership. So we have a collection of member states, decision makers, but also some academic institutions. And this helps us to create this bridge between academia and policy. We work on the basis of 4 core functions, and they are country monitoring, analysis, health system performance assessment, and knowledge brokering. And of course, we could have a whole discussion about each of these functions, although my technical colleagues would be the experts here to tell you about each of those. But I just wanted to highlight the 4th function, so knowledge brokering. And here, I'm not going into detail into these principles or this framework, but I just wanted to give you, sometimes people see knowledge brokering as communication or as dissemination, and they're not necessarily the same thing. So the audiences that access the observatory products, they can access those products in different ways. Knowledge brokering is not a simple list of ways to communicate those products. It's rather a process. It's a dynamic process that allows the evidence and the expertise from our networks to be applied to very specific questions, policy questions, for the benefit of policymakers. So in other words, knowledge brokering is essentially a cross function through the other 3 functions that I showed you. So something else that is also very important is to give you a sense of our target audiences. And I guess this varies from project to project, from institution to institution, and sometimes even from our own biases, because we tend to think that we're communicating with a certain group and maybe we should be communicating with a different one. And our core audiences are, of course, our partners. So the list that you saw on the screen, they're mostly on the policy making side. But then very often they expand to other senior policymakers who could be policymakers from the countries of the WHO European region, where we don't necessarily have a partner. But because WHO and the European Commission are our partners, it means we cover 53 countries across the region. And then we have other layers of audiences, including analysts, advisors, researchers, stakeholders, and advocates. And I would highlight here the future health policymakers. So I don't know if you're familiar with UFA, but there is a network of young professionals called UFA Next, and the same for the European Health Forum Gastein in the neighboring country, Austria, where they have the young Gasteiners, and we try as much as possible to involve them in our communication because they will be the policymakers of the future. So it's important that they are aware of what we do so they can use our evidence in the future as well. And of course, for each of these audiences, we need to be careful and tailor our message and our knowledge to them specifically. That's where the challenge arises. So how do we unpack the evidence? Since we are knowledge brokers, how do we do this? Typically, we do not, and that's important to keep in mind, we do not carry out primary research. So when we say that we provide evidence, it doesn't necessarily mean that we are carrying out the primary research. So we analyze and then we bring together and translate the existing research into something that's usable and actionable and reliable and policy relevant. So many people complain that there's already a lot of information out there. There's a lot of evidence in this world, but the problem is, how do you navigate through that evidence? And I'm sure all of you also face that struggle in your day-to-day jobs as well. Briefly on the tools that we use for this knowledge brokering process. We have policy briefs that I'll explain in a minute. Many publications of different kinds that we use for different purposes and to answer specific policy questions. We publish articles in scientific journals, and here I would highlight the one that we publish, which is EuroHealth on the right-hand side here. Then we also organize policy dialogues at the request of specific member states at critical moments of their policy process. And then either we organize or we participate in platforms and events such as the Observatory Venice Summer School, which is aimed at senior policymakers, but other conferences that I'm sure that you're aware of as well. And then, of course, we have digital channels, increasing digital channels, and they keep me busy every day. But so this is just one element of the dissemination and the knowledge brokering process. And last but not least, our collaboration with networks and experts is key to the work that we do. And without them, we would lose a lot of the connection to the policy audiences across the region that I mentioned in the beginning. And here, of course, I would highlight the Health Systems and Policy Monitor, which is our main network of experts. We're meeting next week in Latvia for our annual gathering. And that's where the Swiss Learning Health System fits into the wider picture. So we're really pleased to work with you in this process. Just so you can visualize how we operate, we have a hub model. There is an office in Brussels for the admin and management and the director. And that's also where most of the dissemination happens. And it makes sense to be in Brussels because of the so-called EU policy bubble. But it's important to keep in mind that we operate much beyond the European Union. We cover the whole WHO European region. And then we have the two sometimes called research or academic hubs in Germany and the UK. So we have the London School of Economics and the London School of Hygiene and Tropical Medicine in London, and the Berlin University of Technology. So essentially, this hub model allows us to have one step in the academic world and one step in the policy world. And that really helps us in our mission to bridge the two. The policy briefs that I mentioned just now, essentially, the aim is to provide useful, relevant, timely, credible evidence to policymakers. We do not provide advice to policymakers, and that's something that we emphasize more and more because I think we all have enough in this world of hidden agendas and, of course, institutions that have to stand for their own interests, and that's understandable in most cases. But I think the unique and the added value of the observatory is really the fact that we are an independent organization, and we simply put the evidence on the table and we leave it to policymakers to decide what to do with that. So we tell them what works, what doesn't work. Sometimes it works in one country, it doesn't work in another country, and then it's up to the decision makers to take that forward. I also think the policy briefs are a very good example of the title of this presentation because we tailor the knowledge in the sense that right at the start, we have one page with 6 bullet points of the key messages, and that's essentially what you can take to the cabinet of a minister and to brief them on a specific topic. Then you have the executive summary, about 2 pages, where you compress the evidence for senior decision makers who are somewhere between the technical side and the political side. And then, of course, you have the core of the brief that provides the information, the full evidence for technical staff who want to understand the key messages. And then the second part of this presentation is making science accessible. So the way we divide the structure of the policy briefs tries to help with that, providing clear language, a narrative, clear labels for sections and headings and boxes and visuals. And of course, we adapt this to the different publications that we have. But for policy briefs, which are particularly popular, I thought this was a nice example to share. I also mentioned policy dialogues. They're a very different way of brokering knowledge, but they're very important to us. And they are essentially a forum for sharing international experience in a frank and open exchange to inform decision-making. And this is very important because sometimes it's very difficult for policymakers to talk openly about the struggles and the challenges they have in their health system and to share experiences. So that's why we operate on the basis of Chatham House rules. And it's funny that a couple of weeks ago at the European Health Forum, Gastein, we had a policy dialogue, and I deliberately did not attend because those who know me know that I have communications written all over my face. And so that's also a way to make sure that they feel comfortable in communicating. And of course, no one ever shares what is discussed in those behind those closed doors. And that's a very good example of working towards impact, because it's not because you don't have something visible out there that it's not making an impact. Sometimes you need these behind the doors conversations to give the evidence. So we bring our experts to the room and they answer the questions in a neutral and independent way. In terms of other channels and activities, because of course I covered some of them, but then there's always the digital side of things that helps to put the word out there. And as I was saying, it keeps us busy. So I like to see our communications approach as twofold. So it's either publication driven or opportunity driven. And if we think about a new publication, the first step is always to agree on the key messages. And sometimes we have these internal discussions about whether we should have communications key messages and then technical key messages. In essence, you should just have one and then you adapt for the different purposes. And that's a very interesting part of this process, because essentially we, the communications people, sit down with the experts to understand what is this work about, why is it being done now, who is it useful for, what are the sensitive issues around it. And with that, we engage in this creative process of developing those messages before we put them out to the public. We also, of course, announce to our mailing list whenever a new publication is out, so through newsletters and social media. And sometimes, depending on the topic that we are covering, we also either write a news item on our website if it's something new, or we pitch the story to the media through a press release. And I know that the difference between news items and press releases is not always obvious, and we could leave that for the Q&A if that's something people are interested in. But in this case, it was a press release we issued to the media about a policy brief that we produced at the request of the Swedish presidency of the Council of the EU. So we work very closely with the EU presidencies, and they ask us for evidence on the topics that are priority for them. And so once the brief was out, we issued a press release, and this led to some coverage, for example, in this case, through Politico in their morning healthcare newsletter. And that's a way to also see this as tailoring knowledge, because we're talking about something that is quite specific. It's not AMR as a whole, it's access to effective antibiotics. It's for a niche audience in healthcare that is interested in the bridge between health and policy. And they managed to summarize our messages into these brief updates in an email. So it's something that we try to do when we feel that it has the potential for media outreach. Still on that policy brief, and using the key messages that we developed together, you can see an example of a more visual format for those messages. That's not necessarily what we would use to bring to a minister, but sometimes also to share with our partners and to make people engaged in this discussion. And especially when we talk about antibiotics, there's a big general public element in it. So we feel that it's relevant to also make it accessible in a visual way. And we also organize several webinars. I would hope that at least some of you have attended at least one of our webinars. They tend to be quite popular, and this one was an example of how we communicate and dive deep into the messages for a specific publication. On the publication-driven side of our communications, we're trying to start doing some videos and engaging in podcasts. And although we don't have our own podcast, I'm proud to say that the Quality of Care podcast that we did for the WHO podcast is actually their most downloaded episode. So it shows that sometimes you don't need to create your own channels. You can just use the channels from your network to reach relevant audiences. Here, just an example of the fact that we celebrate 25 years this year. And we thought carefully about this because although we are proud and we want to commemorate and celebrate what we achieved in 25 years, that's not necessarily relevant to an audience, especially if we think about a very busy high-level policy audience. So what we did was we turned it around into the future, and we had an open discussion about what we think is going to happen with health systems in the next 25 years. And that was a way for us to broker knowledge around our innovation portfolio and to plug in some of our other work as well when we touch on things like the workforce or climate change. And so sometimes you just need to think about the opportunity that you have, and then which product you have or the evidence that you have to promote on that day. That session was really rich. It was 2 hours long, and the recording is available on the website. And coming up very soon, in 2 weeks, we have the Primary Healthcare Policy and Practice Conference organized by WHO. So again, it's an opportunity for us to be in a place where all the PHC people are. And that's why we've been working towards this deadline to make our global study in this topic available then. And I leave here the short URL, which again is communications practice, in the sense that if you sign up for this, then you are added to our niche mailing list on PHC. And whenever we have something that's related to this topic, or when the book is available and we have webinars coming up, we can make sure that we are tailoring this knowledge to a very specific audience in this field of health. And the last part that I would just like to share with you, and I think I still have couple of minutes, it won't take long, but I know that this is something that always comes up. So you do all these activities, and how do you prove that you're actually making an impact? That is $1 million question. It's not a straightforward question to answer, but I think there's some things we can think about here. First of all, is what do we understand by impact? And in our case, and based on our theory of change, our impact is we would strive to have policies that promote better health, well-being, and equity. And I think probably everyone in this virtual room aims for the same. But in practice, what we can more effectively measure is the high-level outcome. And in this case, is to make sure that we support and promote evidence-based health policies. Now, there's a caveat here between the words based and informed. And I don't know if that's obvious to everyone. It was not obvious to me. And it's important to keep in mind that even if you want policies that are based on the best evidence available, you have to keep in mind that there's a lot of other factors that influence the health policy process. So no matter how good the evidence is, sometimes policymakers simply have other things at stake that they have to keep in mind. Some things or criteria are more valid than others, but we have to accept that that's how it works. So the challenges in this process includes the complexity of the political landscapes. And I guess at this point in time, unfortunately, we're living through a perma crisis, and a lot of things influence how health is shaped and health policy is shaped. And also the fact that other sectors influence the health of populations and health systems. So we're no longer talking just about health. And that's fortunate and unfortunate. So the silver lining between the concept of health in all policies or health for all policies is that then you end up competing with other sectors as well for attention. So these are some of the challenges to keep in mind when we think about the impact that we have. That being said, we do have some indicators that we keep an eye on, and I would say there is a very big range between human relationships and online data, and these are all things to keep in mind. Sometimes the one-to-one interaction with a very high-level policymaker can make a huge difference, and you don't need, again, to send a publication to 1,000 people. So we try to capture those moments. Of course, we have direct work with our partners, and many of them are policymakers, like the ones you see in the picture here from Austria and Spain. We have the policy dialogues where we can have direct impact without necessarily communicating it externally. And of course, with our networks, we also hope that the experts help in that process as well. And then you have the other sides of the impact evaluation, which is a little bit easier to monitor because there's a lot of software to tell you how many people attend your events, how many people download your publications and visit your website and engage with your social media and newsletters. So we do keep an eye on this data. It helps us to improve and to make sure, for example, that we have a good balance between academia and policy experts when we want to have a discussion. So it's something that is done. It's just not a very straightforward process. So I would finish with maybe a checklist for policymakers. It's not a fit for all purpose, but these are some best practices when dealing with policymakers. Keeping short messages, using visual elements, comparing data between countries, using case studies, using the national language as much as possible, which is something that is a challenge for us considering we cover a very big region. I put here clear recommendations, although in our case, as I said, we don't necessarily provide advice. We just say this worked and this didn't work. Avoid explaining the methodology, which is a tendency in academic settings. So going straight to what is practical, but of course be prepared to explain how you reach those findings. Take the context into account of a specific setting. Invite policymakers to a dialogue, but in that process, make sure that you provide a safe space and independent space for that discussion. Focus on solutions, not problems, which is, again, from the scientific perspective, of course, everything always starts with a question and with a problem, and then you try and reach the solution. But policymakers are very focused on the solution, and they're very focused on the practical concerns and the economic analysis. So trying to highlight that as well.